الحمد لله رب العالمين والصلاة والسلام على أشرف المرسلين وعلى آله وصحبه أجمعين. Schistosomes by Professor Mahmoud Hani Sulaiman. Definition: Schistosomiasis equal chronic inflammatory disorder initiated by infection with Schistosoma blood fluke parasite, and it causes tissue damage, systemic pathology that often persist into adulthood even after infection abates. Anti-schistosomal immune-mediated pathology is the primary cause of both systemic and organ-specific morbidity. Epidemiology: Schistosomes are prevalent in tropical and subtropical Africa, Middle East, Southeast Asia, East Asia, Philippines, and limited areas in Caribbean and South America, in areas with inadequate sanitation or access to clean water. Transmission of Schistosoma species parasite requires specific intermediate host snails. Human prevalence closely tied to abundance of suitable snail host species in local freshwater habitats. Epidemiology continued. Poverty leads to greater risk of schistosoma infection as a consequence of inadequate sanitation and limited household access to clean water. New dams, irrigation, and urbanization can enhance local snail habitat and increase local transmission. This typically leads to dramatic increase in local prevalence of schistosomiasis. This map shows the world distribution of schistosoma with different types. Manzoni, this is the most abundant places for Manzoni. S. hematobium, these are the most abundant hematobium. Intercalatum, japonicum, and mekongi. Mixed hematobium and Manzoni, these are the great rivers. Here is, to your right, detailed map for Egypt. As you see, schistosoma hematobium all over the country, and this is the schistosoma manzoni. Persons become infected with schistosomes when larval parasite Cercaria shed by freshwater snails, the intermediate host, and then penetrate bare skin. Diagnosis of active infection equal detection of schistosome eggs in urine, stool, or tissue biopsies. Positive antigen testing and or serology support diagnosis in egg-negative cases. These are the snails. Here to the left is the male and female schistosome. This is the female. This is the male. The male is the large, the female is the small. This is intermediate host of Schistosoma manzoni, are various species of biomflary. Here is the pollinus, intermediate host for hematobia. These are eggs from different schistosoma parasites of humans. First one, A. japonicum, B. mekongi, C. hematobium terminal, D. interlacatum, E. manzoni, lateral spike. This is the schistosoma life cycle. This is the male and female worms mature and pair off. They go to migrate to mesenteric vessels of bowel or bladder where females lay eggs. Okay. Eggs excreted in feces or urine. Either Hematobium go to Bolinus snail, Mansoni go to Bionflaria snail, Japonicum go to its snail. All of them give to Miracidia, develops into sporocyst and produce cercaria. These cercaria go and penetrate skin of the human. The cercaria become schistosomata, go to the lung, then through blood, through heart, go to liver where the larvae mature in the liver and give the adult male and female, which again repeat the cycle. If eggs retained in liver, it becomes chronic schistosomiasis. Schistosomiasis in Egypt. Once highly endemic and affecting large numbers of people, schistosomiasis is now low endemic throughout the country. WHO works with MOHP and National Schistosomiasis Control Program to control morbidity and decrease prevalence of infection in all affected areas through implementation of a strategy based on repeated regular mass treatment with antihelminthics of school-aged children who are the highest risk group. Treatment provided through primary school health system and other ongoing health or education programs. Following decreased burden of schistosomiasis in Egypt in February 2014, WHO supported MOHP development of an 8-year plan of action on elimination of schistosomiasis in Egypt. To sustain low endemicity and achieve elimination, new strategies based on sensitive surveillance adopted to prevent resurgence and recur. Deworming of school child continued in uncovered areas, especially in Upper Egypt. This table shows summary of schistosoma species infections of humans, their impact on health, and their recommended drug treatment. Schistosoma mansoni transmission through skin in fresh water contaminated by fishes, intermediate host Bionflaria snail. Geographic distribution: Africa, Middle East, Caribbean, Latin America. Clinical presentation of Schistosoma mansoni: acute abdominal pain, wasting anemia, chronic growth retardation, anemia, grand mal epilepsy, ascites, portal hypertension, and transverse myelitis. Treatment: praziquantel 40 mg per kilogram per day, oral for 1 day. Schistosoma hematobium transmission through skin in fresh water contaminated by urine. Intermediate host Bolinus snail. Geographic distribution: Africa and Middle East. Clinical presentation: acute hematuria, dysuria, wasting anemia, chronic presentation: growth retardation, anemia, decreased fitness, impaired cognition, renal failure, hydroureter, hydronephrosis, dyspareunia, infertility, bladder carcinoma. Treatment: praziquantel 40 mg per kilogram per day orally for 1 day. Patient manifestations of schistosomiasis range from subclinical disease, including anemia and growth retardation, to avert multi-system organ failure. Praziquantel is the drug of choice for treating all forms of established schistosoma infection. Prevention of schistosomiasis. Preventive methods include sanitation, provision of clean water, snail control, and avoidance of contact with contaminated fresh water. Periodic screening and treatment of or mass drug administration for population at risk for infection are essential. Full prevention of schistosoma-related disease requires interruption of transmission to prevent early infection and rapid recurrence of infection during childhood. Regular treatment with anti-schistosomal drugs decrease morbidity among endemic population. وفي النهاية أقول الحمد لله رب العالمين و thank you for your good listening.